Hey, what's going on, guys? My name is Albert, and I'm making this video to help out those of you who are thinking about or about to undergo some back surgery. I am 10 days post micro disectomy on my L4, L5, L5S1, and yeah, it's been quite a journey. I've had back injuries in the past to where doctors said that I may not be able to walk. It was that bad, and I had some epidural and stuff like that, but nothing seemed to have worked except for time. So being 41 years old right now and having to undergo back surgery was kind of a big deal because I promised myself that I would never do that again and just let it heal naturally. But let me just give you a quick profile and tell you what I'm going through. So maybe this video will be helpful for some of you who are thinking about doing it, or may have some kind of may want to know the ins and outs of what to expect. So my name's Albert. How's it going? I'm 41 years old. I'm an athletic build. Right now I'm currently about 198 pounds and possibly sub 20%, maybe 17%. I generally walk around at 190 at sub 15%, and I compete in arm wrestling around 180 at close to 10% body fat. This issue was induced by probably bad form or using a bad leg press machine at the gym, and it took a month for me to get to 90% healed, where I had a slight sciatic pain, but it was nothing to worry about. I knew that it would generally go away as I continually nurture and take care of my body. But I contracted a hacking cough. You know, one of those coughs where you had to cough as loud as you can just to get that itch in the back of your throat. And I hacked so hard that I contracted my back muscles and herniated 2 discs. Stupid. I was in so much pain, guys, that every time I coughed, I would sweat. Or every time I was thinking about coughing, I was already a little bit anxious about it because it hurt really bad. I mean, it shot down the glute, my left side, to the outside of my thigh, down the shin, and to my big toe. And it hurt so bad, level 1 to 10, it was a 10. And I couldn't lay down. If I laid down, it hurt. Life just was 100% non-stop pain at a level 7, unless I irritated that sciatic the sciatic pain, and then life just sucked. So I got an MRI, and the MRI showed that I had L4, L5, L5S1 herniation, and which one of them was causing an annular fissure, which meant that it was protruding through the membrane. And it stuck for me because when this happened, every good doctor had to wait. And I was able to get the MRI from a chiropractor, one of my friend's friend. So I had the MRI, found out that this was the issue, and yet the pain was so bad I couldn't just allow it to heal on its own because I couldn't even lay down without pain. So the best position was just like straight up like this and don't effing move. So couldn't live like that. Couldn't drive. Couldn't work on my with my dogs as a dog trainer. Luckily I was self-employed. I'm a stock trader and a dog trainer. I'm pretty good at it. So I'm just chilling, and my wife was taking care of me, and it was spring break, so I was lucky and unlucky at the same time because spring break generally means that doctors aren't working. So they weren't. But I did have another friend that had to hook up for a really good neurologist. So after 2 weeks, I had an appointment with this neurologist. He told me I had a neurological deficit, which means that my nerves were being damaged. And he basically told me that an example of where if you crossed your legs for 2 hours during a movie, what would happen? Well, what would happen if you crossed your legs for a movie that was 2 weeks long? And that's my situation. So basically, I have to wake my nerves up. I was told to walk on my heels, and my left foot would just automatically just fall down, as if it couldn't hold the weight of my body up with my heels. So my shin wasn't working properly. So that to him was a deficit, neurological deficit. And that was pretty scary for me. I didn't realize that it was that bad. So I had a neurological deficit, and I had this radiculopathy pain that was just ridiculous. and he wanted to do emergency surgery the very next day. So I was ready, I was totally ready. I mean, when you have this kind of pain, there really isn't any other option. Couldn't live like this. So if you're undergoing that much pain, and quite frankly, if you have nerve, if you do the toe test, walk on your toes, walk on your heels to see if you can actually walk. If you can't, go to the doctor. Okay, don't wait. Don't even think that it'll heal on its own, because by then you're doing the same same waiting game as I am, and it may not end well. The nerves may get damaged. In which case, mine is at the moment. 10 days post surgery, I still can't feel my big toe, and I still can't raise my left heel at 100%. But I'm optimistic. So let me explain my journey. You may see later on the video that I'm going to post a little bit of my journey during surgery, or during the pre-operation and post-operation, not during surgery. But before the night before, I was told to get HypoCleanse, which is chlorhexidine, to wash my the surgical area that they're going to work on. Basically, clean it off. They didn't quite tell me to do it in the morning, in which when I went to the hospital, they told me to rinse it with chlorhexidine again. They already had it all set up for me. So my wife did that for me, and I put on these stockings that went all the way up to my thigh, and it was compression stockings. And wow, I mean, I already have problems putting on jeans, regular jeans, so I have to get flexible athletic jeans. So this was a problem. It was hard to put on. So my wife and I struggled to put it on because I was already in a lot of pain. And and you'll see me laugh during the entire thing. I'm not crazy, maybe just a little bit, but the laughter is just my way of dealing with stress. Okay, so I'm not that brave or crazy. So then right before the surgery, they asked me if I wanted a cocktail or something to ease my nerves, and I was like, no, I'm okay, I'll just stick with it. But guys, if they offer, just take it, because it feels really good for me. At least for me it did. Once they gave me that cocktail, I was smiling, and not from nervousness. I was just so chill and ready to go and optimistic. They were strolling me into the surgery room, and I was like giving everyone a pep talk. Hey, you're gonna do great, and everything's gonna go perfectly. They were all laughing at me. I still can hear myself. But right afterwards, I woke up in the waiting room, not in my own room. I had to wait in a room full of other people trying to wake up prior to them finding a room for me to stay. So I was in that room. They gave me Norco, which is hydrocodone and Tylenol combined. I didn't like it. It made my heart really slow. So, well, I had to deal with it because I was in a lot of pain anyways, which was very discouraging for me, guys, because the doctor told me that after surgery, be sure not to play football the very next day, and don't do anything heavy. Don't lift anything over 20 pounds. And I was thinking, great, this is awesome. After surgery, I'm gonna be able to walk, and that was not the case. Okay, I couldn't walk still, but it was right after surgery anyways. What really was discouraging for me personally was the fact that I still couldn't feel my big toe, and I still felt weak on the left side, and I still had sciatic pain. So I was worried that it didn't work. Eventually I got to my room, and they slid me over to my bed, and that hurt a lot too. They gave me a bunch of medication. Flomax is one of them to make sure I urinate, and some stool softeners and all that stuff. When I first urinated, because I still couldn't stand, I was given that bottle that I pee in, and that hurt really bad. I thought I had a kidney stone or something. Not that I know what that feels like, but it hurt really bad, like needles, or yeah, like razor blades. It was just felt like it was wrong. So I was imagining, did they just, when they rolled me over to do surgery, did they bend my dick or something? I didn't know what was going on, and my thumb was hurt. So I was thinking maybe they dropped me, because right after surgery, the surgeon went to my father and my wife and said, everything went perfectly, your husband's really strong. I'm thinking, why did he mention that I was strong? Although I am relatively strong. Maybe they just dropped me, not realizing how heavy I was. But anyways, it was a catheter that went in my urethra. The nurse eventually went through the paperwork and told me, hey, you had a catheter, that's what it is. And I asked her, how long will it take for it to heal? And she's like, I don't know, maybe 1 day, maybe 1 year. I'm like, the fuck kind of answer is that? Anyways, guys, my pain went away after 2 days. And hopefully your nurse isn't as pessimistic as mine. Also, me being 41 years old and being a male, I know that there are a lot of crappy patients that fit my profile. So I didn't want to be one of those. I wanted to be the nice guy, you know. I wanted to tell the nurse, hey, I'm nice. You can do anything. I'll comply. But I had an IV connection. I guess that's considered a catheter as well, flexible too, inside my the vein of my hand, and they wanted to inject antibiotics along with a flush. I think I had that 2 or 3 times, and the first time they did it, that nurse told me it's gonna feel weird, but she didn't tell me it's gonna hurt, because when she pressed it in, it hurt like hell. I was cussing. I was like, fuck, because it was so much pressure, and I didn't want to complain and tell her to slow down or anything, but when they came back with the antibiotic again, I told her, is there any way you can slow down? It's like, yeah, I can slow down. And when she went slow, it didn't hurt at all. So guys or girls, if it hurts, tell them to slow down. I don't know why they don't just slow down in the first place. I know that it's difficult. It takes more pressure, consistent pressure to go slow than to just like cram it all in your vein, but it makes a big difference. And then I was on Robaxin as well, which is muscle relaxer, and instead of Norco, I asked for Tylenol with codeine, which is Tylenol free. That was like the bare minimum. It definitely would not work as well as Norco, but personally I have issues with medication. I tend to believe that when you're in a hospital, guys, they want to give you all the medication, and they're not worried if there's contradictions, because they have ways of preventing anything bad to happen. They'll just give you more medication to counter the interaction, the bad interaction. I wasn't allowed to leave until I was able to stand, so I tried my best to stand the very next morning, and I did, but it hurt, and I was walking just like before, which is very discouraging. But at least I was able to stand and sit without pain. When I got home, I couldn't lay down. When I did lay down, it hurt really bad. Sciatic pain shooting down at a level 10, and that made me really sad. Actually, that broke me a little bit, and that's when I decided I'm gonna get that remote bed, the one where that can recline, because there was no way for me to lay down without having any pain. Once I laid down and my body stopped spazzing, I mean, it spazzed so badly I would break out into sweat and I would shiver, and eventually the pain was, I'm not sure if I adapted, but the adrenaline kicked in, and I would lay down and fall asleep. So I got the automatic reclining bed, and I got a mattress to match it, you know, one of those memory foam mattresses, and that's where I'm at right now. It's helped me a lot, and now I'm a lot better. 10 days post-operation, I had my sutures removed, and I was able to talk to the doctor about me not being able to bend over. I can't bend over more than this right now, and apparently the muscles in my lower back had to be scraped away from the spine in order to get to the area. So that scrape basically broke off a lot of fibers, that connective fibers that allows mobility. So I'm building up scar tissue, in which case I need to continually walk to make sure that there's flexibility, and there's very little, if not any. I can't tie my shoe. I can't put on shoes. I can't put on socks by myself. I can, maybe it'll hurt really, really bad, so it's not worth doing. So that's where I'm at right now. But I am optimistic. As you can see, I'm standing. I'd rather stand than sit, but I can sit and I can lay down, especially with my my bed. I brush my teeth and I shave in the shower because I don't want to lean over for the sink, and that's about it. Oh right, showering. They'll give you this press and seal stuff. That stuff is worthless when you take a shower unless you tape the outer area with duct tape. They don't want that area getting wet for the first 5 days. But my doctor allowed me to rinse the area gently and use antibacterial soap. So I got some liquid hand soap, Dial, which is antibacterial, and I basically lathered the top a few inches above the sutures and let the water wash down with the suds on top of the sutures, and then rinse it off. And then I would pat it dry with a clean towel, and then I'll put on the bandage. But that was the first 5 days. The first 5 days, when I did do a rigorous showering, I would have that press and seal or cellophane taped with duct tape, just to make sure shampoo or any kind of bacteria outside of the bandage wouldn't affect the area. And it worked really well. But I don't understand how they expected just that press and seal to stay on there when taking a shower. So I understand why a lot of doctors may say don't wash at all. But you can if you use good duct tape or waterproof tape, and keep it dry with that, with the press and seal or cellophane. And then after 5 days, I want you to let it breathe. I still had a gauze on top with a tape at top and bottom, just so it can breathe from the sides, because the sutures, you don't want the sutures being rubbing on your clothing. It hurts a little bit. But yeah, by the 10th day, everything's healing nicely. I am continuously taking B12, which is supposed to help with nerve healing in some ways. There's a lot of studies showing that B12 helps regenerate nerves. I'm taking my vitamins. I'm taking collagen supplements, vitamin C, which helps collagen synthesis, and just eating a lot. So I have to be very careful because I don't want to add weight. And the idea of not lifting 20 pounds, hell, if somebody is 180, he can lift 20 pounds, and just to match my 200, we're talking about upper body weight. But it's all relative. So basically all the doctor really saying when he talks about weight restriction is just be very, very careful, which I am, because I don't want to undergo this again. But overall, right now I'm optimistic. I'm very happy about the surgery. If the doctor gives you some optimism saying you'll be able to walk next day, that's very possible, but it wasn't the case for me. But I'm still happy that I went through with it. And yeah, wish me luck, guys. I'm gonna post another few about the therapy I'm about to undergo. I am scheduled to have physical therapy to eventually regenerate the nerves. And yeah, if you have any questions, put the comments down below, and I'll probably have 1 or 2 more videos coming up in regards to this, because I have nothing else to do. All right, guys. Take care, and I'll check you later. Hey, buddy. Can't reach. Can't reach, David. Good boy. Hi, David. Right here.
Alright, you're gonna have to hold it. I'm kidding. Come here.
From my pocket.
No, you're gonna get in trouble. What else do you want?
I'll have to, but I can't have ice cream.
Okay, let's go then. You shouldn't have sugar
you wanted
either.
ice cream?
No,
No?
sugar's not good for you right now.
Yeah, I can't have.
Do you want me to record for you?
No, it's fun. Yeah, because you want to do it with beautiful.
That's the paperwork. I'm gonna check in right here. That's what I'm checking.
Here's my bed. Here's wife next to the bed. This room is tiny. Here's my dad outside.
Restaurant is right next door. Actually, I would say like
That's nice. There's a waterfall.
Oh, it's calming. We're all better now.
Yeah. How better. Okay.
And 8.5.
Usually it doesn't hurt back there.
Good.
It's usually the leg.
So it's the incision.
Yes. Do you see that? Feel my left. I can raise it.
Don't push it.
I can't.
Not- Okay.